I'll give you a quick intro as to how we will conduct the webinar and then introduce you to Dr. Dempsey. If you have questions throughout the webinar, please do enter them into the chat box and we will get to them toward the end. And just to give you a little bit of background on Dr. Dempsey, she founded the Armonk Integrative Medicine Center in 2011 based on the philosophy of integrating traditional medicine and complementary therapies. She believes in the powerful partnership between physician and patient, creating the foundation for healing the mind, body, and spirit. Dr. Dempsey combines primary care treatment and integrative medicine with expertise in thyroid dysfunction, hormonal imbalances, vitamin deficiencies, and food sensitivities. Dr. Dempsey is a member of the staff at Greenwich Hospital in Connecticut. She received her bachelor's in science degree from Cornell University and her MD degree from the Johns Hopkins University School of Medicine. She is board certified in internal medicine, is a member of the Institute for Functional Medicine and the American College of Physicians, and holds a certificate in Vanguard Endocrinology. At this time, we'll go ahead and turn it over to Dr. Dempsey, and she will take it from here.
Oh, hello. Thank you so much for having me today. I'm excited to talk about this topic. This is a topic that I'm very passionate about because it makes such a difference in my patients. Today what I'm going to do is we're going to talk about the role of food sensitivities on health and obesity. I'm going to review what food sensitivities are, give a little background about that, and discuss how food sensitivities are affecting our patients, how to go ahead and test our patients for food sensitivities. Specifically, we'll talk about the Alcat, but I'll review all aspects of food sensitivity testing, and I'll hopefully have some time to go over some great case studies that I think represent what many of us are seeing in our practice and will help us help other patients further. So. So I'll start with, just to give a little background, there are 3 main reactions people have to food. Okay, so I'm not going to really cover these in depth during the talk, but just so we recall, there are allergic reactions to food, and there are intolerances, and then there are sensitivities. And we'll focus mostly on the intolerance sensitivity category for this talk. Now, most of us are very well aware of this autoimmune phenomena, and specifically celiac disease caused by gluten intolerance. And so that is one food intolerance that we see quite frequently. And there are really 5, and I'll go through them quickly. There is the non-IgE-mediated food hypersensitivity reaction. Many of you will know that as the IgG delayed reaction, and that can be tested for in certain blood tests. And there's also a type 3 hypersensitivity reaction, and that's a contact dermatitis, and we won't be covering that for this talk. There are enzyme deficiencies that are a source of food intolerance, and the one that most people are aware of is the lactase deficiency. There are reactions to chemicals in food. We see that with histamines, we see that with salicylates, and so those are causing issues with our patients. But one of the things that we'll focus most on during this 1 hour is the chronic activation of the innate immune system, and that is really specifically what the Alcat test is looking at. So, as many of you know, there are symptoms. The symptoms of food sensitivity is varied. It can affect every part of the body, starting from the GI tract, respiratory tract, dermatologic system, the neurologic system, the musculoskeletal system. I mean, this is really, it is wide-ranging where food is causing a problem. Endocrine system, the immune system, of course. And the question is, why are we seeing all these food intolerances, and what is it? What is causing these food intolerances? And I think you need to look at it as a multifactorial issue. And the way I look at it is, there certainly has to be, there's susceptibility, and the susceptibility is really dependent on many factors. Genetics is always a factor that you have to consider. And so, of course, that's what, patients are bringing with them, right? Their genetics. But you have to really look at the integrity of the natural barrier of the gut wall. And so, if there is the presence of a leaky gut, they're going to be more susceptible to developing food intolerances, especially if there's that genetic component. The viability of the phase 1 and phase 2 detoxification pathways, equally important. And the presence or absence of other cofactors, the amount of food that is ingested, the combination of foods. And I think that we really underestimate the power of stress on our body and what that's doing in the long term. And we know that stress causes increased cortisol levels, and we know that that in turn causes a decrease in the levels of secretory IgA in the gut. And that goes on to lead to a leaky gut situation where undigested food macromolecules invade the bloodstream and activate the immune system. So why are we seeing all these food sensitivities? And I think there's no question that we're seeing more and more in the world. And I think that we have to consider the advances in food technology, including the preserving, flavoring, the pesticides, the fertilizers, all the things that are altering our food we're ingesting and causing a disruption in our immune system. Genetically modified food exposes us to new proteins we've never seen before in our diet, and that's causing these issues. I think further complication, of course, arises from the overuse of antibiotics, coupled with an increased consumption of simple sugars and refined flours, causing an imbalance in the flora of the intestinal tract and an overgrowth of yeast. And we know that yeast overgrowth goes on and causes more leaking, and then here we are again with the leaky gut syndrome. And then you have, again, these food molecules entering the bloodstream and causing an immune response. So, I want to just review how I would approach a patient with suspected food sensitivity, and I think there are, 4 ways that you really could determine what the problem is. You could put a patient on an elimination diet. Many of us do that in our practice, and I'll go through that briefly in a minute, but it doesn't really get at the whole problem all the time, but it can be a good start, especially for patients who are concerned about the cost of testing. Then there's the IgG testing. For those of us who practice in the state of New York, we can no longer do this test. But I think there are certainly downsides to this test. There's no upsides, but the downsides are far outweigh that. And I think that more and more of us are moving away from using that kind of testing. Then, of course, there's the Alcat test, and we're going to spend a lot of time talking about that because that's looking at a specific part of our immune system, and it really is giving us an incredible amount of information and really can lead to better health and weight loss or whatever we're looking for to help the patient. There are other labs that you should look at when you're thinking about food sensitivities. You should check your patients for celiac disease and gliadin antibodies and things like that. So, just briefly, an elimination diet would eliminate the most highly allergenic foods, including gluten, dairy, eggs, corn, and soy. Some people say 4 weeks is sufficient. Unfortunately, food molecules incorporate into our cells, and they can remain there for a long period of time. So, you might need to keep people on elimination diets for months. And the problem with that is that, if they don't see results and they're not sure the basis of the elimination, then it's hard to get patients to be compliant with this type of diet. So, of course, testing, and I mentioned the IgG test, but the problem with the IgG test is that you can get high levels of IgG when you have high levels of IgE associated with that food. So they're already allergic to the food, and now you're seeing high IgG levels. Is that a true food sensitivity, or was that just a result of this allergy that they had? And then also, if you're eating a lot of the same foods, IgG levels tend to be very high in that circumstance. So, so I'll move on to the Alcat test, which is really a different way of looking at our immune system and a different way of looking at how we're reacting to these foods. And it's really, it stands for Antigen Leukocyte Cellular Antibody Test, and it really doesn't measure immunity. What it does is it reproducibly measures the final common pathway of all pathogenic mechanisms. So whether it's immune or non-immune or toxic. And it's really the only test that's been shown to correlate with clinical symptoms by a double-blind oral challenge, the gold standard. So most of you know what an Alcat test looks like. So this is just an example of a test, and it's color-coded. So it gives 4 levels of reactivity red being the most severe, orange being moderate, yellow being mild, and green, no intolerance. It also has a separate section for casein and whey sensitivity, and I find this very useful because this really does give another level of information for the patients. The gluten and the gliadin sensitivity also very useful, and especially in the patients who've tested negative for celiac and they tested negative for gliadin antibodies in their blood, but you know based on maybe what they've told you through their history or maybe what they've tried before that gluten is an issue, and having this confirmation on the Alcat test is so useful. And then the reaction to Candida albicans, another important aspect to look at. You know, Alcat has, I want to go through a little bit about some of the studies that have looked at the use of Alcat, specifically for weight management. Very interesting. Baylor's study used Alcat. 98% of the subjects following the Alcat plan either lost scale weight or improved their body composition. There was another study using Alcat in Valencia where they showed that an isocaloric food elimination diet, which was based on Alcat, promoted enhanced weight loss, comprised more adipose rather than muscle mass, and it definitely showed improvement in weight. So, you know, why is it having an effect on weight by using the Alcat? Well, you know, we know that food sensitivity is causing an issue with some neurotransmitters, particularly serotonin. So when you eat an offending food, the blood level of the neurotransmitter serotonin goes down. By ingesting highly refined carbohydrates and sugars, we cause a rapid release of insulin, and we increase blood levels of tryptophan, which is a precursor for serotonin. So in order to compensate for lower brain levels of serotonin caused by eating offending foods, food-sensitive people crave foods which will increase serotonin in the brain, so it sort of perpetuates this vicious cycle. And we see that more and more, not just with the ingestion of carbohydrates and sugars, but the same holds true for any food that this person is reacting to. And it could be as simple as chicken if that's what they're having a problem with. So that obviously causes inflammation, and again, we're back to the situation of leaky gut. So now you have high levels of insulin, you're causing inflammation, you're causing leaky gut, and that triggers a system-wide immune response. And that causes more insulin resistance and more fat storage. And what's interesting is that the gut flora itself can induce insulin resistance apart from the immune response. So now you have two strikes against you, and now you're leading to a continuous cycle of weight gain. Changes in the gut flora themselves can increase the rate of absorption of fatty acids and carbohydrates and increase the storage of calories as fat. So, you know, we know that obese people have a greater proportion of the microflora from Firmicutes. So at this point, I thought I'd go through, I have 3 cases that I'd like to discuss, and I think they each hit on a little different aspect, but I think they're very useful. And I think this represents really what many of my patients are experiencing after they do Alcat. We're seeing great results, and so I'll start here with the first case, which is a 65-year-old female. She presented with a history of irritable bowel syndrome, migraines, prediabetes, peripheral neuropathy from a chronic L5-S1 nerve impingement following spinal fusion surgery. She had suspected food intolerances to milk and dairy for years. She has a history of anaphylaxis to scallops. She has a history of seasonal allergies and reactive airways disease and asthma, recent onset of alopecia and weight gain, and severe osteoporosis. So, you know, she's somebody that she represents what, you know, what we're all seeing, a lot of the same chronic symptoms that people are having. She was treated for years with the following medications: metformin for her insulin resistance, topiramate for prevention of migraines. She was taking triptans as needed for migraines. She was taking Singulair for asthma and allergies, inhaled steroids as needed for asthma exacerbations, and a proton pump inhibitor for her acid reflux. So, you know, she was on some problematic medications. She recently went on a gluten-free diet after several family members were found to have a sensitivity to gluten, but she denied a family history of celiac. And what she noted was, and this was before I saw her, so she noted that, well, by the time she saw me, she said, well, she had had some improvement in her symptoms, but they were short-lived. And her symptoms returned after a few months. So then she went on to really do an aggressive dairy-free diet because she's known for years that she's had some sensitivity to dairy. She thought it was a lactose intolerance. And so she decided just to cut out all dairy. And again, she had the same response. She improved, and several weeks later, her symptoms returned. So at that point, I saw her, we started doing some testing, and we tested her thyroid, and we tested her insulin resistance and her vitamin levels. And she opted not to get food sensitivity testing at that time, and mostly due to the cost. And we thought maybe we could find some answers elsewhere, so we started looking. And she clearly had, based on her hemoglobin A1C of 5.8, she clearly had prediabetes, and this was on metformin. And this was someone who was actually very compliant with a good diet. She was exercising regularly, but she was really having trouble managing her weight, and her cholesterol, as you'll see below, was 238 with an LDL of 144. Her thyroid was clearly not working correctly either, with a TSH of 2.86, which in my books I would consider a hypothyroid with a very low free T3. She was iron deficient with low ferritin levels, but had been, postmenopausal for about 12 years at that point, and she was eating a regular diet with animal protein. She had also had low B12 levels. She had a normal vitamin D level at that point, but prior blood work did show vitamin D deficiency in the past, but she was on supplementation. So what I was seeing is thyroid dysfunction, insulin resistance, hyperlipidemia, and vitamin deficiency. So she's not absorbing, something's going on, and she's on a gluten dairy-free diet at that point. So we were a little bit more aggressive with her diet, and I put her on a paleo diet, and lower carb and higher fat, and we treated her with Armour. I put her on some activated B vitamins, and she had side effects to iron, so we had to discontinue that, and we put her on high-dose probiotics. We did a bunch of other things, and then she came back with some results. She had her hair stopped falling out. She lost about 4 pounds. Her TSH levels were better. Her lipids came down a bit. We lost about 14 points on the LDL. But her IBS was still present. Her migraines were better but not resolved, and she still had the neuropathy. So at this point, she agrees to Alcat testing. She realizes that we need to go the next step, and we do the test. And these are the results. So I'll go through the red column, which showed garlic, haddock, and quinoa. And the interesting thing about her diet was when she went gluten-free, she clearly changed over to a lot of gluten-free grains, and quinoa was her favorite. So she was eating a lot of quinoa and not feeling good. And garlic is something that I see very often coming up in that kind of column. The moderate intolerance, you'll see the little darker ones, or the foods that she had incorporated into her diet over the last few months. Buckwheat was again another non-gluten grain that she had incorporated. Flax seeds and kelp, because she knew she had a thyroid condition, so she was eating all this kelp, and pear, turkey, and a bunch of other things. So again, we're seeing a lot of the foods that she's eating a lot of, and we're also seeing other foods that she's eating and she's clearly having symptoms. In her mild intolerant category, she had apples as a problem, and chamomile tea, which she was drinking all the time because she thought it would calm her stomach down, and salmon, and a lot of things. So we looked at the blue columns, and the blue columns showed that she definitely had a mild reaction to gluten and gliadin, and this was already off of those foods for at least a year or so by then, and I find that interesting that she's still reacting. She definitely showed a reaction to whey, which wasn't surprising, and so what we did was we eliminated all her reactive foods, and she followed the 4-day rotation diet provided by Alcat, but she really only ate the green foods. At that point, I really needed to get her system quiet, and so we created a rotation plan just incorporating the green foods, and she did that for a month. And then what she came back and what she noted was within 1 week, her bowel symptoms subsided. At 1 month, her bowel symptoms were resolved. And this is somebody who really had bowel symptoms all her life, even since childhood. She's never been symptom-free. After 1 month, she added her yellow foods, the mild foods, back in a 4-day rotation. She still, at that point, was still noticing that certain mild She was still having symptoms from certain foods that were still on her mild list, and so she continues to avoid those. She continues to be gluten and dairy-free, of course, and she lost 10 pounds in 4 weeks without really changing her calorie count, which is again very, very interesting. Her migraines improved dramatically, and she recently cheated on the diet and had 1 migraine. But other than that, if she doesn't cheat, she doesn't get migraines, and many of her medications have been slowly weaned off. So I think this is a remarkable example of how we can help our patients with these similar symptoms. The second case is a young girl. She's 25, and she is what we would call a very allergic type person. She has anaphylaxis to all fish and all seafood. She has suspected food intolerances for years, possibly dairy. She has a history of irritable bowel. She has significant severe eczema, seasonal allergies and reactive airways, and polycystic ovarian syndrome. So she came in initially, and we looked at the allergic component with IgE, and we looked at IgG at that time, and she clearly had a lot of the IgGs were reacting to the same the things that she was reacting to with IgEs. She clearly had IgE deficient seafood, which we knew. She had IgE to milk and casein and nuts and peanuts and many other foods, and the test was really amazing for her because it really cut out a lot of foods that she was eating. But she did the elimination diet for 3 months, and she had some improvement in her IBS, but after a month, she was still considerably symptomatic, and she was still having abdominal pain and cramps at least 3 days a week. And then after a period of time, she started noticing more eczema and more fatigue on this elimination diet. So we'd taken her off of all the IgE foods and all the IgG foods, and she was still having a problem. And what was very frustrating to her was the eczema, which was not responding to the topical steroids that were given to her by her dermatologist. So we decided at that point to do the Alcat test, and it did confirm what we suspected, that she had gluten sensitivity. And I think what's important to note is that people often think of oats as not being gluten, and there are gluten-free oat options. But what's really clear is that there are proteins in oats and some other non-gluten grains that cross-react with gluten, and that's what we're seeing here. So she thought oats were fine, and they weren't for her, and that's what the Alcat tests. The casein and whey sensitivity was confirmed, and we knew that. But there were a lot of other foods that she had been eating, including kale, millet, beets, and broccoli, that were on her moderate list, so and severe list. So these are her test results. She had kale come up as a severe intolerance, and again, something that had been incorporated in her diet for years. Many of the fish she showed an intolerance to as well, which was no surprise. On her moderate list, again, a lot of the foods that blueberries and things that she was eating on a regular basis. She was very healthy and an athlete. And in her mild category, again, the broccoli and beets and flax seeds, things that she was eating. So within 2 weeks of going on the diet, we put her on a rotation diet again, based on just the green foods at first. Within 2 weeks, her bowel symptoms completely resolved. She had more energy within a few days and had a 5-pound weight loss after a month. And this was somebody who didn't need to lose weight, actually. She was normal weight, but it just kind of came off naturally. Her eczema was initially resistant to the treatment and the diet again. And then what we did was we reviewed all her skincare products. And it was very, very obvious that there were multiple ingredients on her Alcat list that were known irritants. So wheat germ, which was in many of the products she was using, was obviously she was sensitive to, so was probably exacerbating her eczema. Soy, the same thing. Oats, parabens, again, known toxins that are going to be irritating to many people. And her eczema responded dramatically after changing her skincare products. So for 25 years of her life, she had had eczema, which completely went away with the right diet. And then looking at the skincare products based on the Alcat results. And I think that's important. That's something that I think is overlooked. So I wanted to bring that to your attention. This third case is a little different, but again, I think exemplifies what what we're talking about today, and how looking at food sensitivities can help people with chronic diseases. This was a 70-year-old woman who had quite a significant history. She had a diagnosis of multiple sclerosis for years, which was coming into question at the time that we started down this road of testing. She had a long history of migraines, hypertension, hyperlipidemia. She clearly had metabolic syndrome, hypothyroidism. She had severe osteoarthritis and required a right knee replacement. She had kidney stones. She had evidence of small vessel cerebrovascular disease. So she had some mild memory loss, depression, a history of breast cancer, and multiple vitamin deficiencies. So she was a complicated case. She complained of persistent headaches, fatigue, insomnia, depression, diffuse joint pain. And initial testing indicated a vitamin D deficiency, an elevated hemoglobin A1C. She was clearly pre-diabetic. She had low HDL. She had elevated homocysteine. We did heavy metal testing, which revealed the cadmium toxicity. We did organic acid testing, which revealed some other issues that needed definitely to be addressed. So we reviewed her diet. We made some changes, and we cut out a lot of her refined carbohydrates and sugars because she was eating all that. But she really had a hard time following a diet. And she also had an issue with binge eating. So she agreed to do the Alcat test. And what came out was, again, what I see a lot in my practice, and that is that a lot of the foods that they're eating often can come up, but also foods that we're thinking as healthy or just are fine are not. So patients who are going on gluten-free diets, and this is a patient who had attempted a gluten-free diet several times, and instead of eating gluten was eating corn and rice and things made out of that, and clearly that was something that she was intolerant to. So putting her on a gluten-free diet alone was not going to help the situation. And so we cut out the corn and the rice. And here again we're seeing quinoa, again in the moderate intolerant category. We're seeing olives, olive oil, which she's using a lot, and sunflowers, which she was picking on. But the quinoa I want to make a point about, because I'm seeing this a lot in my practice, and this is anecdotal, but it's coming up a lot in the severe and moderate categories. And what I'm thinking may be at play here is that quinoa was a grain that was really eaten in a very small region in the world by a small number of people in the world. And I think about the genetic possibility of that. That there are people who are eating that probably were genetically able to eat that, but the rest of us who were not from that area of the world probably are not designed to really eat quinoa. So I see that a lot, and so I think that's something that you need to keep in mind when people are going on these gluten-free diets and just adding different grains in. And so for her, again, her mild intolerance category, coffee came up, which was going to be a thing that we really needed to address and cut out. So she followed the rotation diet strictly for 1 month with only one deviation, and that was remarkable because she's never been that successful at keeping on a diet for that long. During that time, she had 1 migraine for the entire month instead of her usual 2 to 3 per week. And the migraine occurred right after she cheated, so she knew that. What she noticed is her food cravings started decreasing dramatically, and I think that that's really what kept her on the diet for as long as it did. And it became very clear after just 1 month that the original diagnosis of multiple sclerosis may not have been true. That many of her symptoms that she blamed on the multiple sclerosis actually started getting better even within 1 month on the Alcat. I'm certainly not suggesting that everyone with multiple sclerosis can be cured by a food sensitivity test, but I do think that it raises a very interesting point. There are a lot of people who are very symptomatic and have symptoms that are suggestive of a disease, but may have some other reactions going on. And I certainly think that it's worth ruling this out as a possibility. And she's had significant improvement. And she was somebody who's coming into the office very frequently and very frequently asking for medications. And she now comes in very infrequently and feels dramatically better. So, so in closing, I want to, just say a few things that we know that foods play a significant role in our health, and I think we're starting to realize more and more that we really are what we eat. I don't think there's any any patient that I can help if I don't address their diet first. That has to be foremost in our minds. The other issue really is that we're being exposed to things in our environment and in our food supply that we've really never been exposed to in the history of mankind, and it is affecting us. And we have to start educating our patients. I mean, many of us obviously know that, but I think it's about educating our patients so that they know the steps that they can take in their home, in their environment, and with their families. And we're seeing more and more people as they age experiencing these food sensitivities. And again, the cases that I discussed, the last case was a 70-year-old woman who went through all her life and now is being diagnosed. Now, she could have had food sensitivities all her life, but it's what we're seeing is I think that there's just a rise in it in general, and for many of the reasons that we discussed earlier. Inflammation is known to be the root of all chronic health conditions, including obesity. And one of the major causes of inflammation is food sensitivity. And so evaluating that and looking at that with this test is key. So, what can you do if any of your patients have signs or symptoms of food sensitivity or intolerance? I would strongly consider the Alcat test. And I would follow the rotation diet as recommended by Alcat. I think there are probably different ways that you can interpret it, but I have found in my practice that really sticking to the green foods, the ones that have no reaction, are best for the first month to really get the patient into a situation where their body is just less reactive, and then you can start rotating everything else in. Even with negative testing, the point I want to make is that I still would consider gluten intolerance as a major contributor to obesity and other chronic diseases. And so sometimes I'll get an Alcat test and it will show negative for gluten, but they have so many other things that I'm suspicious, and I'll take them off the gluten anyway. Obviously, eating organic food, avoiding genetically modified foods such as corn, soy, wheat, etc. Very, very important, and take care of the gut. And what I didn't cover in this talk is really, the things that I do to heal the gut in addition to eliminating the foods. But there's certainly lots of things that I think about when I'm healing the gut, and probiotics, of course, number one. Glutamine is something that I use quite frequently, and there are a variety of others. So at this point, I think I'll end my talk, and if there are questions out there, I'll open it up for questions.
Okay, let's take a look at the question box. If anyone does have questions, you can go ahead and enter it into the chat box on your dashboard, which should be on the right side of your screen there, and we can address them going from there. As of right now, there are no questions. We can wait a minute or two, see if anyone's typing.
Okay. Okay. Would anybody be interested in me discussing more about sort of a protocol that I use for leaky gut, or to discuss even more about the Alcat testing and how else I'll use it in my practice?
All right. Okay, give me a second here. We do have a couple questions.
Yeah. Okay, great.
Just a moment here. Well, first off, there's a couple people that asked if the presentations will be available, and both the slides will be available and the recording of the webinar will be available. You can contact your account rep, and it'll also be in the practitioner section of the website. Let's see. There was a question about the quinoa. Is the quinoa properly washed and cleaned before cooking? Could it be a reaction to the coating of the quinoa?
Well, again, when what they're doing with Alcat, when they're testing for the quinoa, they're using a purified form of formulation of the quinoa. So if people are reacting to that in this test, then I think it's the protein in the quinoa, not so much the coating or anything else. I think that's a good question.
Okay.
I think it's important that people. Sorry. Can I say one more thing?
Yeah, go ahead, please.
Okay, great. What I want to mention about the Alcat is that, when they're testing these foods, they are using a very purified form of the food, so it sort of eliminates all the other possible contributors to sensitivities, right? There are no pesticides associated with. There's nothing else, right? They're using the purified form. So that's it.
Okay. There was a question. Sorry, let me just scroll back to it.
Sure.
What exactly do you mean by green foods?
Okay, I'm sorry. When I say green foods, I'm talking about the foods that come up on the green column on the test. So let me see if can I go back on my slides?
Yes, you can. Let me just give that control.
Okay, because I want to show a picture of the Alcat chart. So again, the chart is 4 columns. Can I go back now?
Yep.
Okay. I don't know where which slide it's on, but I'll find it. Okay, here it is. So when I talk about the green foods, I'm talking about the green column. So these are the foods that the patients have been tested for that they're not intolerant to. And so these are the foods that I'll really have them concentrate on rotating. And again, Alcat provides that rotation diet, which basically is it's a 4-day rotation diet. So once every 5 days, you're kind of rotating it. And I'll have them just concentrate again on the foods that they're not intolerant to at all. And then we'll rotate the mild yellow foods into it so that we can start to get the body sort of used to those foods. And I want to mention that I have found it useful after a period of time to retest people. So what I want to mention is that, so let's say I'm doing this for a month where they're eating just the foods in the green column, and then after the first month I'm introducing the yellow, and we'll rotate that for several months. The moderate column, the orange column, can be reintroduced after approximately 3 to 6 months. It really depends on the level of leaky gut, whatever else is going on, and how they've reacted to the introduction of the yellow foods. So then once that's reintroduced, then you can start thinking about maybe reintroducing the red. So the whole process, let's say, is at least 6 months. It may be useful somewhere around 6 to 9 months to repeat it and see what's happening. What I have is I have a handful of patients who have gone off the rotation diet and have just eaten a lot of that green column food, a lot of those foods, and even the yellow foods in excess because they can't eat all those other foods. And they kind of get in a rut and they eat the same food every single day. And then you repeat the Alcat, and now they're reacting to the foods that they never reacted to before. So I think it's important for some patients to kind of keep them on track with the rotation. And the way I use the blue columns, which are the blue boxes in the bottom, which are looking at the gluten and the casein and the candidas, I'm looking at that, particularly the gluten, as sort of a lifelong issue. And that's not something that I'll reintroduce after 6 months. That's something that indicates that they are really intolerant. And I see people react to that even if they've been off gluten for years, so that I know that that is an issue. So that's sort of how I interpret it.
Okay, great. We had a question, what level of Alcat panels were used in the different case studies for the patients that you worked with?
That's a great question. Many of the patients, I'm using the 200 food panel. So if I'm going to do a food panel at all, I'm always doing the 200 foods, because the problem is if you do anything less than that, then you wind up in a situation where people start asking, well, can I eat this? And then you don't know what if they can because it hasn't been tested. So I think that when you're going to do testing, you have to do the 200 foods, and that's what I do. And then I believe the woman, which was the second case, which was the 25-year-old, we also did, we looked at her medicinal herbs because she was taking a lot of supplements. And I find that that is a really useful panel to use in people who are on a lot of herbs or incorporate herbs in their regimen. So those are the panels that I probably use the most. And then the other panels I'll use for other patients, depending again what their background is and their history and what they're being exposed to. But these are all as a basic level 200 foods.
Okay, great. Dr. Dempsey, can you recap the low serotonin gut cascade involving inflammation, et cetera?
Sure, sure. So, so we know that. Okay, hold on. Let me pull that slide up again. Actually, oh, I can't.
Yep, I'll give that control back to you.
Okay, thanks.
Okay, go ahead.
I apologize. Let me just grab the slide because I think it's good to just have it on hand. Okay. So, so what happens is if you're eating a food that you are sensitive to, you know, there is evidence that serotonin is affected by that, and it's through a variety of different mechanisms. So you're eating a food, your serotonin is down, or maybe serotonin is down for other reasons, but that causes you to want to raise your serotonin levels. So by eating foods, particularly carbohydrates and sugars, we know will raise the levels of tryptophan, at least temporarily, through insulin, and that's a precursor for serotonin. But other foods that are the offending foods will do the same thing. So what happens is initially the serotonin goes down, and then you eat other foods and it goes up. And it goes up and down, and that sort of perpetuates the cycle of craving food, which causes this initial increase in serotonin. You get like a serotonin blast, but at the same time it causes a lower serotonin level chronically. So then you keep on perpetuating the cycle, and then you wind up with this sort of like binge eating situation, which obviously then leads to weight gain. And that increase in insulin that occurs with the ingestion of the highly refined carbohydrates and sugars, and again, even the foods that you should be eating based on your sensitivity panel, causes inflammation. We know that insulin in itself causes inflammation, and that is sort of how the serotonin and the insulin kind of perpetuate that inflammation, and we know what inflammation does to our body. So it causes, obviously, weight gain, obesity. It causes other chronic diseases. Every disease that I deal with has inflammation as the basic root of it. So eating foods that our bodies are not meant to eat, are sensitive to, are leading down that cascade. Does that make sense?
Okay, thank you. I believe that covered the question. There's a question, can you briefly explain the process again of inflammation leading to weight gain?
Okay. So so the way I look at in this situation, let's think about the gut as the source of actually of what's really causing the weight gain, because it's really all starting in the gut. So if you have a leaky gut, and again, the leaky gut is really coming from so many problems can lead to leaky gut, right? So many issues. So antibiotic use, eating foods that you're not supposed to be eating gluten, which is breaking down the barrier, and just chronic chronic bad health, all this stuff causes leaky gut. And that allows, so leaky gut is really, a gap in the cells that are supposed to have like a tight junction between them. So now you have this leaking, you have this gap, and food particles are now entering our bloodstream. And they're not supposed to be in our bloodstream. Food, you're supposed to eat food, it's supposed to go through your digestive system and come out the other end. But food particles should not be entering into our bloodstream, but through a leaky gut they are. So now they're in the bloodstream, and now our body is recognizing these as foreign particles. So now that's triggering an immune response. So we're seeing that as a foreign body in our blood system, and now we need to react against that. And that reaction in itself is really, leads to inflammation. You have sort of a burst of cytokines, and the whole process that goes on, right? And then that is really inflammation. That inflammation then actually causes more insulin resistance and more fat storage. And the gut flora now is disrupted, and that goes on to cause more insulin resistance. So again, it's really all starting in the gut, and if you can heal the gut, get rid of the foods that are causing the problem, then you're going to lower insulin resistance, and people are going to lose weight. So I believe that the primary mechanism is through the insulin issue caused by inflammation, which is essentially from the leaky gut.
Great. Thank you, Dr. Dempsey. There's multiple questions regarding how often you would recommend retesting.
I certainly wouldn't retest less than 6 months, but I think probably somewhere after 6 months, maybe even a year would be where I think it's best. Because what happens after 6 months is people are sort of really trying to figure out what their maintenance diet is like. And if the patients are really doing well and they feel good on this diet and they're really good about rotating it and there are no new problems creeping up, I think that you can even get away with not retesting. However, for the majority of my patients, they still, they're trying hard and they're still noticing some symptoms or maybe even new symptoms at that point. And so by 6 to 9 months, you really want to get an indication. Are you on the right track, and are you really, doing, the right things with their diet? And so 6 to 9 months would be probably good. 1 year is fine, just to get another view of their body. And I have to say, very often it does look different. And I think people are concerned when it looks different because, so well, what happened in such a short time? But our immune system is ever changing. So we will be reacting to something at one point, and we'll change things, and now we'll react to other things. The important thing is that we hope that the reactions are less. The red category, you hope that the red column is shorter, and the orange column is shorter. They're having less reactivity. And if they're not, and I think this is important, if you're not seeing a real big change, you're seeing maybe a change in the types of foods, but you're still seeing a lot of reactivity, that is still an indicator of a leaky gut. And that means that you haven't finished healing them. And so even though those foods have to be addressed and they have to be eliminated, you have to be more aggressive at healing the gut because their immune system is still very reactive.
Okay, great. Thank you. There is a question regarding autoimmune disease and whether these patients should have Alcat testing done.
Yes. Yeah, I do believe that this is a great tool for our patients with autoimmune disease, because autoimmune disease is just one reaction of our immune system. And so these patients are not only reacting to themselves, but they're reacting to all these other things in the environment. And I've used this test in a number of my patients with autoimmune disease, and it's really made a difference in their lives.
All right. Give me just a moment here, getting through the questions, Doctor.
Sure. I think the best example, just while you're looking, the best example is really Hashimoto's, where we've been taught that Hashimoto's is really irreversible. It might be, but I've certainly seen people's antibodies go to 0 after following the Alcat diet. So these are people who had high antibody levels. They could be as high as 3,000. I've seen that. And they're clearly reacting to their thyroid. And we take out the gluten, and then we take out the other foods, and their antibodies go to 0. So it looks like they don't have Hashimoto's. Now, they're still autoimmune people. They're still sensitive, and I wouldn't go so far as to say they don't have it anymore. But I'm certainly happy with that because I know that their body's not reacting as much.
Okay. There was a couple of questions about probiotics and what kind and how much do you recommend?
Yeah. In this case, I think you really need to look at other things outside of this test. You may want to do some other testing to look at like organic acid testing and other tests that will look at other parts of the body, even GI testing, to look at what their flora is really like. But just generally speaking, if you haven't done the testing, I like a broad spectrum probiotic that has bifidus and acidophilus, and so you want a variety of different strains. At minimum, I'm using 25 billion, and actually I was at a conference recently where they're really talking about looking at the data as to whether it really makes a difference as to how much bacteria is there. And there seems to be some evidence that it actually doesn't matter as much as we think. So there are people who are using 100 billion and 200 billion. Anecdotally, though, in my practice, I do think it does make a difference because I have patients who clearly respond to higher doses. So at minimum, they're on 25 billion, but if they really have this leaky gut and they're really, they have a lot of reactivity, they're probably on somewhere around 100 billion units for at least several months, along with some other things to heal the gut. So I think the magic number for me is usually about 100 billion with a broad spectrum probiotic.
All right, great. What is the earliest age that you would recommend testing?
Yeah, this is an interesting question because I think that this test can certainly be used in children, and I've done it in children. I think probably where it's going to be easier is probably maybe over the age of 5, and that's I'm just throwing that out just because I think younger than that it's very difficult. I even think at that age it's difficult to follow this type of diet. But if you have really parents that are really willing to change the food that they're buying and work with the kids, and the kids are willing to do this, then it could be done as young probably as 2 or 3. But I think that probably somewhere around 5 we can really start managing their diet better. You can do, for kids though, you can do the smaller panels. You can do 50 foods to start, and that you can probably do that in infancy just to kind of get an idea if you have somebody who's struggling with a child who is having reflux and colic and a lot of things, and you don't know what's going on. Well, at least figure out if it's a dairy, gluten, or whatever problem. So you can do a 50-food panel on a small child. Now, as the children get bigger, you go do bigger panels because it would be unusual for a 5-year-old, although there might be 5-year-olds who are eating quinoa. It would be unusual for them to have such a variety of foods in their diet. So for children, we'll do smaller panels, but I think they can be very, very helpful. But you need very, very dedicated parents because this is a complicated endeavor once you get the results. Because to tell a child that they can't have this and that, it's complicated, yeah.
Just wanted to add a quick side note regarding that. Any panels less than 50 foods, our software is not able to generate a rotation diet, so that's something to keep in mind as well because it's a very helpful tool.
Oh, okay, good to know.
There's a question, do you always recommend to eliminate the moderate list for at least 1 month?
The moderate list or the mild list?
They may have referred to mild, but it says moderate in the question.
Okay. So I do almost always eliminate the mild for the first month. The circumstances when I don't are when patients are really struggling. Their green column is very limited, and they feel very overwhelmed because there really are there's so many they're so limited by the number of choices they have. So in that case, we'll let them have the yellow column, and we'll use the rotation as long as they're doing the rotation every 4 days, every 5 days, based on Alcat's recommendations. Then we're fine. And so those are the patients that I'll let them do it. But if they really have a robust green column and they have a lot of choices, I feel like it's not necessary for them to introduce things that they are clearly still reacting to. And so in those cases, we eliminate it for a month. I have patients we have to eliminate it for longer, and I have patients that obviously that I've done it shorter.
All right. There's a question here regarding what other things do you typically use to heal leaky gut other than probiotics? You mentioned glutamine briefly. Can you talk a little more about that, dosing, etc.?
Okay. I think that for glutamine, the use of glutamine, I prefer the powder. There are pill formulations, and a lot of patients argue about doing powder formulations. So if I can get them on the powder, I'll start them slow. Actually, I'll start them maybe on 1 gram a day, and I'll go up to 3, 4, 5 grams a day, depending on how they're tolerating it and what kind of response we're seeing. And ideally, glutamine should be taken on an empty stomach. But I have a lot of patients who really just don't want to drink that powder, so they'll throw it in a protein shake, and I can get it into them that way, and at least they're getting something. So that's what I'll do for the glutamine. I think there are other useful tools. Aloe is very healing on the gut, and there are some preparations that incorporate glutamine and aloe together, which is a nice formulation, but certainly it can be taken separately. Drinking aloe juice is a great way to get it in. And again, you mentioned the probiotics. There are a variety of other gut healing supplements, herbs and vitamins that can be used. There are immune supplements that I sometimes use to help the immune system deal better. So it's not just about healing the gut, but I'm also trying to get the immune system a little bit quiet. And so there's some really great formulas that I use for that. And if I think if I think they have yeast overgrowth, then I think it's important to consider not just adding more probiotics, but getting rid of the yeast. And there's some, again, good herbs and supplements that are anti-yeast, ginger and caprylic acid and a bunch of other things can be used. Or if needed, even fluconazole, which is a medication, but it can be very helpful if you have somebody who has a significant yeast overgrowth and you're not going to heal their gut, and they're not responding to the herbs. I think medications in that circumstance is necessary.
All right, thank you so much, Dr. Dempsey. I think we're going to wrap it up. There are still quite a few questions. For those of you who didn't get your questions answered, we will get with Dr. Dempsey and get you answers to them, most likely by email or by phone through your sales reps. So we do have the list of this, and the recording will be available. If you do have any other questions, you can also shoot us an email at info@alcat.com, and we will get it to Dr. Dempsey. For the time being, that is about it. We thank you so much, Dr. Dempsey. This was a really wonderful webinar.
Oh, it's my pleasure. Thank you so much for having me.
Thank you so much, and thank you all. Have a great night.
Good night.